morning to all.
Good morning.
Thank you so much for that introduction, and it's a pleasure seeing all of you. I know most of you, and those I didn't know prior, I now know. So thank you very much, and thank you for having me. And we have our Administrative Office Manager, Mr. Tory Deal, here with us as well, and our tech guy. And Tory will just keep. I thought I had to do not disturb. I thought just cancel. Yeah. Thank you. So don't worry, we're streaming for those who couldn't make it. So we got permission from Ms. Cartwright. She said it's all right for those who couldn't make it today. And we're ready for our presentation. So again, thank you to the Bahamas Public Service Union, Northern Region. Thank you for Madam Vice President, Ms. Latonia Cartwright. And you all chose the right one for the job. Because she is going to push things forward.
Yes.
And in keeping with your training and your theme, wonderful theme for this year, igniting the passion for trade unionism through knowledge empowerment. And so it's a delight to be here again. And we will be sharing on something that we all are quite familiar with, and we've had to endure for such a time. And so I appreciate that prayer. That prayer was so sincere. And that's the type of prayer we need now, Brother Curry. You know, sincere talk with the Lord about what's happening. He didn't make it fancy, he made it just personal. And we need a personal prayer these type of times. It is a critical time. So Tory, whenever Tory sets that up, then we will start. But we thank you, and those who are watching, again, thank you for joining us. As you might be aware of, if you're not, let me just give a brief summary of where we're at globally, and understanding that what we now call the coronavirus. And it got that name, of course, from the way it looks. It looks like a crown when they look at it. So this is one of the viruses that we call the coronavirus. And it's called novel coronavirus because it's a new type of coronavirus. Even though coronavirus is not new entirely as a virus, this is a new strain. So it's called novel, or the new coronavirus. And it has these crown spikes that comes off it. And it causes what we call the SARS, which is the syndrome it causes, which is severe acute respiratory syndrome. Okay, so it's primarily a respiratory condition. And some of these symptoms we would have had to deal with over the last few months. Or let's look at some of the common symptoms, symptoms. Patients can present with fever, cough, shortness of breath, loss of taste or smell, headache, muscle pain, sore throat, okay? Now, this is not limited to that only, but these are some of the things. Now, let me point out just for a few minutes. And why I'm doing this is because the virus is spread by respiratory droplets or from anything contaminated bodily fluids. And if it's touched on an object and someone touches it, puts in their nose and their mouth, or if they someone sneezes, coughs, or is in close contact. So there's a science behind why they say 6 feet, because it's believed that if someone coughs, sneezes, or talks, you still need 6 feet for it to travel. But now scientists are showing it can go a little further. Because if someone sneezes, it can shoot up even up to 10 feet or so, right? But the concept is, if everyone wears their mask and adhere to these protocols, then we will be at least given some measure of protection. Are you with me? And so I'm showing this virus as well is because when you look at now the impact of it on the mental health of the individual, it's for a number of reasons, and we're going to discuss those reasons. Just a little history also of the global. We can keep it on this page for 1 minute. When we look at the global impact, the latest stats we saw this morning, 96.2 million persons have been infected worldwide, with 2.06 billion deaths. The Bahamas, we've had 8,068 cases current, reported, and 175 deaths. course, in the U.S., the numbers have reached another critical milestone, 402,000 deaths, and estimated 24.3 million cases. Now, India is second. And of course, you would have listened to the news where there is suspected and now a suspected new strain in the UK, and we're seeing Europe and UK shutting down again. And those strains have been found in South Africa and also in California and some parts of the US and some other countries is coming up. So when we talk about this condition, this virus itself, it can have a number of impacts on the mental health. When you look at the virus, is it the virus when inhaled? The first part it takes through the nose, it goes through the olfactory nerves. This is the nerves that supply the nose and for smelling, and so it goes to the brain. It attaches to that part and travels to the brain. Is the changes in the mental state related to the virus itself getting to the brain? What some of the symptoms, and we look at some of the symptoms of the mental health. Is it because the brain itself now becomes inflamed, or the inflammatory reaction causes persons to have a change of mental state? And that change can be confusion, dizziness, depression, anxiety, even psychosis. You know, some people, present with these symptoms, and we think, oh, just leave them, nothing's wrong. But it could be the virus itself attacking the brain. It can be, now, the body's immune response. So the body triggers this immune response, okay, and releases all of these phytochemicals called immunochemicals, cytokines and the interleukins. These are just some of and of course the immune cells, like the white blood cells, the lymphocytes. Okay, the whole immune system gets involved. And those levels of, the body's response can cause mental changes. And then, of course, persons who end up in hospital because now the virus invades the lungs, and now they're not getting enough oxygen. If you have a shortage of oxygen, that can cause changes in mental state. We've seen in those who work in hospitals, someone's, not getting enough oxygen into the lung, the oxygen level, we call oxygen saturation, drops. You can have challenges with, memory, recall, and behavioral issues. You ever seen someone who in hospital, they have some difficulty with getting oxygen, they can become very aggressive, combative, and you might think, oh, this person is just, misbehaving. No, their oxygen level is low. They're not getting enough oxygen in the lung and then to the brain. Also, another point that can affect a person's mental state with COVID is the fact that some people might need to go on a mechanical ventilator. And that in itself can be a challenge. Because again, low oxygen concentration. And finally, in terms of changes, and we're going to look at just a few types of mental health challenges and discuss them briefly. Finally, in terms of the disease process, is it the medication that some people go on? Is it causing that change of mental status? And of course, we've seen a few cases already in the country where, and it's a reported clinical picture, if I could just say it that way, where persons who would have had corona now have some deficits in their mental state. You would have heard of some of that. It's called mental fog, or brain fogging, in which we've seen some clients who've had that. They had the disease, it has some effects on their brain. Now they're trying to go back to work and they're just not functioning like they used to, and it's real. So the employer or the persons around them say, what happened to this person? No, they might have had real damage to the brain. They might have had low oxygen for such a long period of time. They did have some brain injury, and now they are coming back and they're not functioning fully like how they used to. And so more studies is coming on, and I want you to read on that. It's called brain fogging. and they're having some just functional problems afterwards. So this topic is very, very timely, and I wanted to talk about that because, you know, understanding this condition is not just you're going to get over it. No, it is having some long-term effects on some persons. And so your workforce and everything's going to be different. All right? Now, of course, when we look at the overall health, mental health includes our emotional, psychological, and social well-being. If we could keep it there for a minute. There are a few challenges when a pandemic hits. Number one, you know, it's a new thing. And of course, the word pandemic means it's across countries and across nations all at the same time. And so we have a major change over the last year. Our lives have changed, hasn't it? Yeah. Life has truly changed from the first, and it goes by step. The first thing is a pandemic, you know, or you first heard of it in Wuhan, China. So that's across the world. That didn't affect us. Then you finally heard it traveling in London. Then the first case in the US. Oh, okay, just one or two. We're going to get over this. Then, you know, all of a sudden within months it's here. Then it's around the world, okay? So the anxiety of that whole thing coming, preparing for that. Then it comes in. Now remember, your life is still going on. You still have to go to work, you're still trying to feed the children, you're still trying to pay your bills, and all of a sudden, now you have laws implemented. That could be a stressor, is it? Yes. Now you have to wear a mask. Now all of you look like doctors and nurses, huh? You all see what we had to deal with for years. Okay? Now you have to wear the mask. And I can remember when that first happened, we had to be shut in. Now it was an adjustment. Some of you who haven't been home for, I can leave that right there. Some of you who haven't stayed home for months now found yourself home. Children running around making noise. Huh? That spouse who you went out to see for an hour or two in the evening before you go to bed. Oh, come on now, let me leave that right there. If you don't, I'm happy you all have the mask on. I don't see expression. Now, you don't realize the power of just going outside. Now, it was a challenge. It's a mental health challenge. Now, you used to communicating and going to see relatives, friends, and family. Now, you're isolated. Now, you were in a confined space. Now, you can't go to your favorite restaurant and to your favorite store. All of this is real impact. And sadly, for some people then, you know, loss of job, loss of income. That's a stressor. This thing is real. Okay? Some people lost their job. Most of you here, you're quite fortunate when you work for the public sector. Thankfully, our country has kept the doors open in that aspect. But persons in the private sector are feeling the pinch. And some of you, if you know, you work in the public, or your spouse, or your relatives, or someone else who lives in the house works in the private, well, that could be a little stressor. You imagine two people working in the private and shut down and don't know when things are going to turn. So all of these are real factors. And I want us to also think about the children. Don't overlook them. I've spoken to some parents and some children, and they're feeling the pinch as well. You know what it is to get up every day, get dressed, go to school, as much as they cry and don't want to go to school. But now being shut in, boy, they feel it. Not being with your friends, not being able to, you know, play the sporting events, you know, not going to the after-school club programs. And we are dealing with things, and now we got to try to reach out to them and create new opportunities. And you who are in the school system know that even trying to get this whole system adjusted online, they thought it was going to be easy. It's very challenging. Kids don't have internet. I ain't going to call no companies. Internet's slow sometimes. They're dropping this and that. Okay? Don't call no name. We love you. You're recording. But all of these things, and they have to sit there now, where in the past you drop the kids off and they're there. Now you have to be there to supervise. They go through every session, do all the homework, take the lunch break and in the evening home. I mean, life has changed, and these are added stressors that you're dealing with. So this whole pandemic didn't only affect the individual, but it's affecting the family, the home, the society. All of us together, corporately, we're feeling the changes. We're feeling the challenges of some of the things. So this is why we're here to talk about this. So now, guess what happens? In the midst of this, you still have to go to work. And in the midst of work, you have to now all these changes, sanitizing everywhere you go, face mask, social distancing, which is good. Or now you have to work from home, you come in only half day, and you know, what's the certainty of work? So, and then you might have had some colleagues who were infected, or sadly, we pray for the families of those who lost loved ones, or lost co-workers. I lost a good friend, young guy, in his early 40s, healthy, and that's gone. We've lost so many like that, eh? So, when you look at this, we are still learning. There's no one solution any of us can give any group, because this thing is still developing. And I told my family I've made up my mind. Even with travel, you can't travel. You made it in your mind. Listen here, this is for another 6 to 9 months for us. Let's just take it easy. Okay? Better get some seeds. Let's plant some seeds. You go in the yard. That's all you can do.
Yeah. Buy a pool.
Huh?
Buy a pool.
In this freezing cold? All right, yeah.
No, for the summer.
For the summer, that's true. Because you know it can be.
Order it now because it's cheaper now.
It's cheaper now. That's true. You're going to have to, very good. You're going to have to create this type of thing. These new activities. So COVID-19 affect the body both physically and mentally. And of course, all of these points I've said already. And this doesn't even include those who already had an underlying medical and psychiatric, psychological issues. Imagine someone who already had difficulty coping. And for Grand Bahama, only the grace of God is with us. You know, you imagine coming out of Dorian, just starting the bill, and the first few weeks after Dorian, you're just trying to survive.
Yes.
Light off, food, damage, water, the whole place. And then January, when things just start to open up, you're trying to get your little thing fixed, shut down again in February, March. And a whole year goes by and we're still here. We were just talking about, you know, out east. So, really, how we made it is only the grace of God. I will tell you that now. Come on, clap your hands for the Lord. Only the grace of God, and we are because, you know, we haven't even dealt with that yet. And so I truly believe there needs to be, you know, and when I see people on the road or in the store, I see them in the clinical setting, you know, I have a kind of extra heart. You have to extend that because people are, you imagine your roof and all this cold is still exposed. You're shut down for pandemic, you're waiting for money, you lost your job, the kids home, food need to eat, you have pressure and sugar. Plus now you're scared that you can't go anywhere because, you know, you don't want to infect you and your family. And it ain't gone yet. It's still developing. And so I'm so happy for this topic. You know, when Cadre called me, I was happy. I just dropped everything because I know every little thing we do to make a difference and to sensitize people, we have to do it. When you get back to your workplaces, be cautious with people. There are people I'm seeing who's still sleeping on the floor.
That's right.
There are people who are in this community whose lights are still off.
That's right. My God.
And so we all have to be each other. And when people come to work, they don't need just stress and issue. All right? If you could be that agent to say something, you don't know, people are on the brink, you know. They're just not talking. If I show a hand, I mean, you got totally damaged or partial damage, I don't want you to put your hand up. But every day you go out, so it affects your whole life. Okay? So what type of things we have to look for next? We have to be cautious now of these things, your mental health, okay? Staying balanced and creating new opportunities. What type of things can develop during this time? Of course, yeah, so let's go to the next one. I'll come back to this story. Let's talk about some of the common cases that we see. I'm wrapping up shortly. So yes, so keep going. We'll look at post-traumatic stress. Let's look at anxiety. Because post-traumatic stress is a form of that comes under the category of anxiety, generalized anxiety disorders anyhow. But you know, the whole anxiety and people respond differently.
Yeah.
There are some people during the storm or when they hear about COVID again or lockdown, or even I had some clients who, because of the mask, they get anxiety. You know, just wearing a mask, they say, man, I feel like I'm suffocating. That's new. Some people are having panic attacks over these things. So if that's you or people in your area, department, please don't just tell them, brush it off, child. The Lord will make a way. Yeah, he can make a way. But you still got to get some help for them. Listen to what they're saying. They're going to tell you exactly. We always, you know, respond after someone injures themselves or hurt themselves. I saw the police report from Nassau, the Meet the Press saying how many died and comments made about how many, you know, why the suicide happened. Man, this thing is real.
Yes, it is.
I'm a healthcare provider and I help people with this, and I felt, huh? I keep telling my family, boy, if I feel in this and God has helped us, you know. Imagine how my community and my city feels. You're not weak because you have depression. You're not weak because you have anxiety. You're not weak. This is a real thing. You are really hurting.
Yeah.
So open your eyes in the workplace. You might be the only hope. Some of you will have to bring some people and say, no, let's go. And you know, union people, you're going to have to set up something so that people call. They say, listen here, man. No, we're not being difficult on the job. It's not. I'm trying to be nasty. I'm at my brink. We were talking to Ruben earlier. She, you know, shared how, you know, she just lost her husband last year. And life is still moving, you know.
Yes.
This is not the regular death of loved ones, and you know, this one getting sick and still things are still happening.
Yeah.
Or you know, who you know, you had a loss as well, and you told me about, you know, the pastor who had 3 or 4 people died in 1 year last year. So yes, this is okay. Life is still going on with all of this. Okay, so anxiety, the feeling of, you know, now when you just have nervousness is one thing, but if the symptoms causes you to be anxious and irritable, extremely fearful, and some people have even physical symptoms, you know, sweating and shaking and shortness of breath or panic attacks, you know, you've come to a point you need some help. And sadly, when you don't address these, I drive around and see fellas at the bar. I used to judge them years ago, you know, till I realized, boy, most people who are drinking like that, they're self-medicating, you know.
Yeah.
You sit and talking to them, they tell you, boy, my doc, man, I can't sleep. If I don't get my little half pint, this is the only thing that keep me moving. What you want a man do? I'm not telling you to drink now. I'm not advocating because that causes other problems. But I'm saying, when you talk to the man, right? And he tell you, man, look here, boy, if I don't get a half pint before I go home, it can be problems.
Wow.
I'm doing this is helping me to get to work and get home and pay the bills. Because no one addresses, especially men. I'm happy to see some men in here. You have to take time. Don't be afraid to say, listen here, family, friends, I know you all putting all the responsibility on me. Daddy, brother, uncle, grandpa need to go get some help. And let me go clear my head and get some professional help. It's all the responsibilities on you. Okay? So if you have these symptoms and it's overwhelming and it's affecting the way you function and you operate, yes, you need to get some professional help. Yeah? And they will provide some either medication. I know the mamas, people say, boy, when you take medication, you're crazy and all that. Don't worry about all that. Call you what you want. When I take that, not me, I'm just saying, when you be careful what I say these days. These things on Facebook. Like a friend of mine from Nigeria, he came, he said, man, I'm so happy. I'm so happy. Listen here, I taught something the other day and it went virus. So I want to make sure this don't go virus. Some of you look and say, what's the joke? It's not virus, it's viral, okay? Go viral. And he said, make it go virus. So I don't want this to go virus. But you need the help.
Yes.
You need the help. You need the help. Yeah? So, next. And don't go to the bottle and don't go to the marijuana. You see the young fellas? And some of them, yeah, it's recreational. Some of them, they tell you, man, doc, I just need to hold a Mary, man. I just need huh? If I don't take this play, I'll trip out you. If I don't take this play, they try to numb their anxieties. Okay, depression. You're not, and for many years, we overlook it because it's a stereotype. If you say you're depressed, man, get over it.
Yeah.
You're crazy. Man, what's wrong with you? Man, you soft, you weak. Huh? Not tell the person hanging themselves, oh my God, I didn't know there was, I didn't understand. I didn't know they was not going through that.
I didn't know.
It's a lie. You see them come, all of a sudden, not the happy person. She used to come and have a little makeup and lipstick and put her hair on now, her piece go on one side. It used to be straight, them things were together, now she come in the, huh? Why we play like that in our community? You know we know the story. You know the man leave the woman. You know she left with them 3 children alone, struggling. Oh, I know how she get to that state. I didn't know the lie.
Yeah.
You had her for talks. Not you, these people on Facebook. You had her for talks, you know.
Yeah.
You see her come to work, child, you see her there? She going through her husband leave her for one young woman. Child, you see her son there? He got court case coming up. I know that boy. Them boys, there's problems, boy. What do you say? And they go and do something we didn't know. Or they letting go of some people we didn't know. It's real. So this time is very intense. And so persons who would have had depression now, it's heightened. Can you imagine those persons? Some who weren't depressed and easily depressed. You have 10 things happening at one time. This is the effect of it. Okay, so depression is really a very serious thing.
Yeah.
It should be treated like any other disease, heart attack, stroke, or anything. And of course, persons who have had a heart attack and stroke and corona or had a loved one, I mean, it's just developing. So your workplace don't even have a policy for it yet in most places. What happens if you have corona? What happens? How long do you have to stay? Do you still get paid or not get paid? Do you have normal follow-up? And then we didn't mention this. A loved one passes away from corona. Some people had to bury the loved one alone. Or you can't try. I mean, it's different factors. So the depression, I'm wrapping up right now. So it's real and it's an emergency, especially if a person becomes sad and loss of interest in activities for a period of time over 2 weeks, and especially if they're not functioning on a job and they give you any hint of, they want to kill themselves or kill others. Sometimes people get depressed, they won't kill themselves. They want to kill the children. They won't kill the husband. They won't burn down the house with everyone in it. There's some serious stuff. It's real. Depression is real. All right, next. And some of the symptoms we talk about: not eating, not sleeping, not, their normal self in the workplace. They're not functioning. They're not talking. They're just withdrawn, isolated. You see the change. And they come in every day and it's not the normal function. You have people that are feeling worthless, feeling helpless, can't concentrate, can't focus. Next. You don't know anyone like this? Don't answer. Okay, next. All right, so and then, of course, as this disease continues, whenever it ends, we pray it ends very soon, people are still going to have the fear of these things. Fear of, oh man, is this going to come back? And when you listen to the news, it stirs you up. Oh, a new strain, oh my God, what does that mean?
Yeah.
Huh? How many of you feel that way? New strain? It can come here? How long it's going to be around? It's like it's opening that thing way back again. Numbers are down. Yeah, we can move about. Then a new strain, numbers rise, we got lockdowns. We get, oh my goodness, the fear. Anytime you hear a message coming up, you're watching the TV, oh my God, what are they going to say now? Oh, that's only me or some of you. It's like, my God, what this national report going to be now? What going to change now? What going to take away now? And so it's real. So post-traumatic stress is, when you experience a crisis, and every time the anniversary or the event or something related to that event comes around or is mentioned or is seen, some persons who lost loved ones through corona, or work. Some of you might have had a workplace where there was a person who got infected and you had to close down. Going back, imagine the teachers, the hospital workers, imagine going back. Man, you all need some serious prayer. On the front line, you can imagine knowing every day you going in an environment on the front line, many of you. Williams? And it's your job, you have to go. Every time you go in that yard, oh my God. You're shaking. Next. So thank you very much for that. So my final statement on the matter is we are still in this very challenging time. We're going to have to do it together. Of course, maintain all of the policies, the hand washing, the face masks. I need to take this off so that, wearing your face mask, keeping your social distance. Tell your family and your loved ones that this is important. All right? Don't get slack. We're still in the middle of a pandemic. I have to remind myself and family, hey, no, hold it now. We're still in a pandemic. Don't get lax. Not because we see numbers down, but stay focused. This is 96 million, coming to 100 million, and countries are still locking down. This is going to be with us for a while. I'm praying it goes away right up in a few months, but we're still in the middle of a pandemic. Don't get slack. Don't get comfortable in the workplace or home, because it's a community thing. It's a community thing. It means, I always tell people at work, if one person gets infected, you put everyone at risk. One person can come to the workplace and infect everyone, then go home and infect all the family members, and it will affect the community. Come on. So we have to think for each other. We have to think for the community. We have to think for people's families in doing the right thing and making the right decision. In the workplace, please continue to educate everyone. Keep a vigilant eye, you union leaders. Keep a vigilant eye on persons around you who are, at risk for any of these conditions, and get them the help they need. Those who would have had loss from corona, there's no words you can give them, because the whole process, you imagine, a relative gets corona, they go to the hospital, they're isolated, you can't visit them, you can't see them, and sadly they die, and you can't, there's no words for that. So if a loved one has experienced that, be very sensitive and supportive. Or if one of your staff members have had corona, don't segregate them. A lot of people don't want to get tested because they feel, boy, if I tell them I had corona, they treat you like you had the plague. And so a lot of people are not getting tested because they feel, boy, if I have corona, they can treat me a certain way. Even when I recover, they can be funny with me. So many of them choose not to get tested or report to work, or report to get tested because they feel they're going to be, what do they call the word? Prejudice or segregated or, okay? Stereotype. And if I could recommend, I don't know how we're going to do it, this is still developing. I don't know if your union is going to provide fundings for people who don't have the money, because not everyone has $200 to get a test. Okay? And so workplaces need to say, boy, look here, the union has a couple dollars, so when you really don't have it, well, let's see how we can put something together so this person who has some symptoms, you get tested. Because if they don't feel they have an avenue to come to someone to get a test, $200, that's my grocery for the month to feed the children. What are I going to do? All right? So all of these factors are affecting how people are managing, but together we can do it. So thank you for having me. I encourage all of you to continue to pay close attention to your health, continue to build your immune system as best as you can. I like these fruits and stuff. We only can do our part in fighting and sanitizing and building our immune system, asking our families to do that. And every day educating those around us, like these type of forums, to stay safe. And God forbid if someone has any symptoms, they know it's an easy process for them to get help. They can go to their supervisors, their managers, and they can walk with them. Sometimes it's not easy for them alone. They need someone to walk with them and say, hey, listen, let me go with you. And then, if they are positive, they need a supportive system. Say, look, you imagine a woman with 2, 3 children and they get positive. Who's going to take care of the children? How the children get to school? See, all these things. So let's continue to be each other's brothers and sisters, and we will do well. And with God's help, the help of Almighty God, we will get through this. We will get through this in time. Thank you very much. I'll leave it open for a question or two if you can. Thank you very much again. Thank you. Ladies first, I'll come to you. Yes.
Okay. There was a controversial statement made in the press recently by one of our leaders in reference to suicides and males being weak because of it. What is your take on that
That's
statement?
total ignorance. Total ignorance. I make no apologies for saying that. And the person who said I know very well. So that individual can call me if they have anything. Because I know them and they know me very, 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 very well over the years. But there is an ignorance meaning lack of understanding. I don't mean nothing bad. You can leave it or you can turn it off. Thank you very much. So.